Well, welcome back, class. We're here with Sally again at Voices of Courage, and we're moving into segment 5, which is why cultural awareness is really important in practice. So, um, uh, tell me a little bit, what does that mean to you, Sally, cultural awareness, and why is that important in your work?
I think really that what that means to me is that everybody's experience is different, and where you were brought up and your experience through childhood and into adulthood just shapes who you are. I mean, to me, that's what cultural awareness is.
And one of the things that I always like to liken cultural awareness is way more complicated than just race or
Yes.
religion or gender. You and I are both, Caucasian, but that doesn't mean we have the same culture. Uh, Even if I was a person of color or you were a person of color, it doesn't mean we don't have similar cultures. It's much more complicated than that. So, how do you assess culture when you get a referral?
Part of those questions are in our initial paperwork. It asks about gender and race and things like that. And I kind of look at a little bit of the family makeup because it might possibly tell me a little bit about what to expect. But also, I don't know what to expect the first time I meet a family. And it's to me, it's all about asking questions in a genuinely like curious way, not in a non-judgmental way, but just let them teach me about where they're coming from and their perspective and
Yeah,
why they are seeing things from a certain way.
because they're, in all reality, they're the expert, right,
Yes.
of themselves, and they're an expert of their lens and how they see things. Um, I'm not an expert in any culture, but I love what you said, to genuinely ask in a really open fashion, because we have to be aware of our inherent biases when we have culture. I mean, that's obviously
Mm-hmm.
present. Are there any cultural um, improvements that Voices of Courage are aware of and need some work on and tweaking on in the next year or two?
We only have our paperwork for assessments available in English, so we probably should be working on getting those to be available in Spanish. But we actually don't have a therapist or a forensic interviewer who's bilingual or speaks Spanish. But we do have a Hispanic population here in St. Joe that is most likely very underserved and
and
would
and
very
growing
much benefit from trauma related services.
and growing.
Yes.
So, yeah, absolutely. And um, I think you're absolutely right. We should never stop thinking about the process of culture and our practices, because even when we just think we've got it all figured out, you'll get someone that's from Somali, or
Mm-hmm.
you'll get someone that's from Thailand, and you're not going to have paperwork in you know
Every language
every
that you
language.
might think of. Yeah.
So yeah, it's certainly an issue. What's been a interesting thing about culture that you've learned in your practice since you finished school? Do you have a moment or experience with a client that sort of opened your eyes about cultural awareness?
I think like you mentioned earlier, I think culture goes beyond race and gender. I think it goes into different things like socioeconomic status and that, my socioeconomic status might be different than my clients and using that knowledge, to be able to build an alliance, knowing that my experience has been different than theirs.
Yeah, absolutely. And it isn't just all those things, it's also disability and education level and capacity and competence. All of those things have, certainly an impact on culture. I know constantly I'm trying to always, use my eyes and my ears when I think about culture, to be really careful, because it doesn't take much to put your foot in your mouth
No.
when it comes to culture. And then, unless you're really reading the client well, you don't even realize that you've put your foot in your mouth if you miss the gasp or the jaw drop, from the client. So, all right. Well, thank you, Sally. We'll go ahead and wrap up section 5. All right. In this segment, we're talking about cultural awareness and certainly diversity. A huge value for social workers, a platform that we should be advocating and fighting for. So can you talk a little bit about cultural awareness in the practice of hospice care?
It's so big. It really is. There's so many things. You'll never know everything, but if you can know a little bit about something and let the people know who you're working with, hey, I don't understand. Can you teach me?
Is that okay to tell a client?
Absolutely. I have been greatly received by all of the families that I've taken care of when I've said, I don't understand your culture. Help me learn. Jehovah's Witness is something that I struggle greatly in understanding, and I've had several that I've taken care of, and I've been able to say, help me understand, help me learn so that I can help serve you. And there have been times I've gone in and I've stuck my foot in my mouth because I just used to the way I do things or the ways of many families that I serve, and here's this family that are Jehovah's Witness, and no, that's not how we do things.
Right.
But they've been great, and appreciated the apology and the willingness to learn. And I think that's a lot of where it comes from, is if we're willing to learn about their culture and how they do things, they're more receptive to being able to receive.
Yeah, because they are the expert of their culture.
Absolutely.
So if we treat them as the expert, I know sometimes students are hesitant to tell a client, I don't understand. They don't want to come off that they're not qualified or equipped to deal with the client. But in all reality, it gives that client that expert component.
Mhm.
Oh, you want to know more about Jehovah's Witness? Well, let me tell you about
Absolutely.
Jehovah's Witness.
And you know what the truth is, and like I said, we're never going to know everything. And it's okay to say, I don't know, but let me find the answer, or will you help me learn? And as long as you follow up on that, they don't mind if you don't know, but be genuine and be honest with them about that.
And because it's hospice care and it's death and dying and grieving, there are thousands of different aspects to how we value that or fear that or how we embrace that. And that certainly is a cultural awareness component, which would be death and dying. It isn't just the food I eat or the clothes that I wear or the color of my skin or my religion, but it is all the way down to our value system and how we see things.
Absolutely. And providing our clients with the dignity and self-worth that they deserve. Just because I walk into a home that isn't run the same way as mine or isn't as clean as mine does not mean that they don't deserve the same level of care as I'm going to give somebody who lives in a better home.
So, yeah, really important to have that cultural awareness piece. Most difficult cultural challenge that you think you had, aside from Jehovah's Witness?
We have taken care of some Muslims. While rare, we have done it, and that's been a very big barrier both to our nurses, to our chaplains, to the social workers, to everybody involved, because that culture is we're going to take care of this and we're going to do it. And so when we get those opportunities to come into the homes, we really have to step back and wait for them to give us permission to do things,
Right.
even as simple as taking a blood pressure.
If the client was a woman or the wife, that the Islamic religion has very specific rules about who can see her hair and her, aside from her face, exposed skin. And even for a husband, talking and dealing with you could be difficult because he's not used to maybe having to run things by a woman. So that you're right, that could certainly be really interesting. So I was in a home that was a Muslim home, and I wasn't aware of it at the time. And I turned to greet the woman, and she would look at the husband before answering questions. And after about 3 of those, I just put my notebook down and I turned to the dad and I said, I keep putting my foot in my mouth. Can you just tell me a little bit about your values and who you are? So you're right, that shouldn't be afraid to ask for help and ask questions. So. Hey everybody, welcome back to another topic here with Jackie. We're going to talk a little bit about cultural awareness. You've heard me talk in other lectures that cultural awareness changed in the Code of Ethics in 2018. It went from cultural competency to awareness. So how is cultural awareness important in your practice in domestic violence, Jackie? Is it something you have to pay attention to, or can you just ignore it?
Oh, absolutely. I have to pay attention to it. You couldn't ignore it if you tried.
No, I know. Stupid question.
No such thing. But cultural awareness is very, very important, and I am appreciative of this shift from cultural competence to awareness, because we can never be competent in somebody else's culture. And I think that it's very important in my field in domestic violence, because it is a gender-based violence. However, it does not, it can affect anybody. Anybody can be a victim or survivor of domestic violence. There is no population, demographic, socioeconomic status that is immune to power and control in a relationship. And so while that kind of sounds a little scary, it also is really important for me to know that there are people that will reach out to Roseburg Center for Shelter that might have a 6-bedroom house on, state line somewhere. And so on the outside, how could they possibly need shelter? They must have a very good income, but financial abuse would help inform that situation as to why they might need emergency services like that. And they're completely 100% deserving of those services as well. And so it's important that I recognize those various demographic statistics based in research, but also to know that if a man reaches out to me for services, that I have the same regard for him as I would for a woman or somebody in a same-sex relationship versus a cisgender relationship. So all of those components are constantly, so that's even kind of maybe a little assessment as well when building that rapport with a client is, who is this person? What makes them who they are? And that includes culture. And it's very important to recognize its impact on how somebody functions in our society, which may be a society that embraces a culture that is not theirs. And I think that's really evidenced by our current administration in the White House, as far as various policies and shifts in tone that have resulted in a stark decrease in access to services for Hispanic and Latinx populations. It is troublesome, it is worrying, because not only is there a stark decrease in them accessing our services, but also simply calling 911. So,
right. If I call 911, are they going to be more worried about me being a Latino and whether or not I'm here documented or not, rather than truly coming out and assisting me in what my 911 needs are? No doubt about it. I do think we are battling an uphill stream without any paddles in regards to cultural awareness. I think it is definitely, it's taken a turn for the worse, and you would think 2019, 2020, 2021, we'd be at a much better place, but we're really not, unfortunately. So, all right. So, quick question, put you on the spot. A culture that was challenging to you, that you had to really go and do a little bit of research on, even though you're out of school and you've graduated, a culture that you just outside your scope.
A culture outside of my scope, let's see. Deaf culture was really challenging for me. Not only am I not bilingual verbally, but I definitely don't speak sign language. And so sign language, people that are deaf or hard of hearing that use sign language to communicate have an entire culture around that.
Culture.
Yeah, like
Absolutely.
I learned about name signs and things like that, and that you cannot create your own name sign. One is created for you by a deaf person. And so until they you build that rapport, that's kind of one of the signals in the dynamics of that working relationship that you know that trust is there and that rapport has been established, because there's a name sign that basically just shortens your spelling out your name to a symbol or a sign. So that was really interesting to learn about, but it was also something that I needed to learn about. And I learned a lot from that particular client about their culture and how I can.
I think it's a place for us as social workers to allow clients to shine. When we stop, take a step back, and we say to them, can you just share with me a little bit about who you are?
Yeah, just asking.
Just asking.
Just asking.
With nothing but validation and open-ended questions. So,
yeah.
All right. Well, thanks, Jackie. Appreciate it. Hey, welcome back, class. Continuing with Erica, we're going to spend a couple minutes talking about cultural awareness, cultural diversity. I had a social worker share recently with me that she's worried that true cultural awareness and diversity is dying socially, and it's certainly a rough time, no doubt about it. How has that benefited you in your practice as a social worker, being really attuned to a person's culture? In culture, it's so easy to define this. It's not really about skin color, it's not really about gender, it's not about age. It is maybe about all of those things, but just because you and I are both Caucasian doesn't mean we have the same culture.
Right.
So how has that supported you in your practice, and what's that been like for you in your journey as a social worker?
Well, I think the most important thing I've started with when I think about cultural awareness and diversity is my own perspective, my own biases, my own culture of where I come from and who I am and how that's made me who I am and how that impacts my work. So I always have to be self-aware of kind of where I'm at, and then I can take into learning about somebody else that's not similar to me. And so cultural awareness, especially here at Restart, we see any and everything you can imagine in our shelters and in our housing programs and our youth programs, as far as the things you just identified: race, gender, sexual orientation, religion. We see the full gamut. And so I think the biggest, most important thing for people to understand when we're working with them, whether it's a client or a peer, is that it's not asking questions or trying to judge or cause harm to anybody. It's trying to learn and understand where they're coming from and what their perspective is and what their culture is. So I know I can just be more informed of how best to work with them and things that maybe they can do or that they can't do based on whatever their culture may need or have.
I think you hit the nail on the head when you started with before I can truly embrace awareness, I have to know who I am and where I'm coming from.
Yes.
So looking back, and not just at Restart, but your other experiences, what was probably one or two of the most challenging cultural opportunities that you were presented with?
So I think when I was younger, first starting out in social work.
You're still young.
I said younger.
Younger, okay.
Yes,
all right.
when I was fresh social worker. How about that?
Fresh,
Okay.
fresh,
One of the biggest challenges I faced was my age and not having children of my own at the time. And how are you going to help me? You're young, you don't have kids, you don't know anything, you don't know what you're doing. So it was the culture of family and the culture of a family dynamic that I was challenged with pretty frequently when I was working with parents and children and families. And so I really just came to say, you know what, you're right. I don't have kids and I am a younger person right now, but I'm here to learn. I want to learn about you, what your family system is. I want to hear what your challenges are, and I want to see how can I help you with what I do know and what I do have. And so that was a couple different very prominent, occasions when I was first starting off, was the age and being childless. And so it's always an interesting kind of line to toe when it comes to that, because you don't want to overstep, but you also want to learn and you want to try to understand and be understanding. So I was just very open with accepting and acknowledging that you're right, I don't, but I'm here and I can be helpful. How can I be helpful?
Yeah, I think that's really great, and I think a lot of my students will experience that exact same dilemma, and I have heard social workers say in response to that, well, this isn't about me, and that is an answer you can give, but I don't think it's the warmest, friendliest,
Right.
fuzziest alliance building answer.
Mm-hmm.
To validate their concern. You're right, I'm not a parent, or I'm I haven't raised teenagers. And just validate that, I think, is a better alliance building and better respect to their culture. So, all right, perfect. Thank you.
You're welcome.
Hey class, we're back with Michelle White at Truman Hospital. We're going to talk in this segment about cultural diversity, cultural awareness. It is a value of Truman Hospital. One of the things you might find in your practicum settings, in practicum, in your second year of school and top of your foundation year, some agencies will have in part of their mission statement or their value statement, their respect and their embracement of diversity and awareness. So how is that an important component of your practice here at Truman?
So Truman is an incredibly culturally diverse patient population.
Probably one of the most in
and-
the city.
Yeah, and even professionals. Our professionals, our medical professionals, staff come from different parts of the globe. So, for patients, it's being aware of those little things, little nuances of a culture. Like for our patients from the Middle East, it's not being alone with someone of an opposite gender, or we run into Jehovah's Witness and they don't accept blood transfusions. So it's just pointing out to the physicians, this, they decline blood transfusions, or reminding them that this is, patient is from I don't know, China, or Myanmar, or somewhere where elders are really respected and they don't put their family members in a facility, their elderly family members. So it's just pointing out and educating cultural nuances and competencies that may get lost on the medical professionals.
So you see yourself as a bridge between the docs and nurses and the patient as far as educating them about culture, which means you've got to get educated
Right.
first. Tell me a little bit about you, who are you, what makes you you, and then you convey that on. I think that sounds like a really critical element. Can you imagine healthcare without that connecting bridge?
Right. And
It'd be a disaster.
Exactly. Where I'm getting pushback from the med team on a patient who's 80 years old and from Mexico, and the family doesn't want to put them in a facility. That's perfectly normal for their culture not to place their elderly family members in a facility. So,
All right, put you on the spot. Most interesting cultural dilemma this last year, last couple of years.
oh,
You really had to dig down deep.
oh boy. I don't really know. I'd have to think about that. Since I've changed from oncology, it's a little different.
Well, one of the things and maybe I'll throw you a bone here, because oncology, cancer connected to the negativity of life ending, not everybody is going to prepare for a life ending issue the
Right.
same. And so loss and preparing for loss, and that's certainly different for every culture.
Yeah, from a religious perspective, I have seen a few times where I've talked to a patient about a diagnosis and I get the responses, yeah, I'm aware of it, but I don't claim it. And, I had to follow up with my father-in-law, he's a pastor, and say, what's this all about? And, he explained to me that some religions see that as, if I don't claim something, it has no power over me. So.
All right, good to know. Good to know. Well, thanks, Michelle. I appreciate it. Hey class, we're back with Trayvana at the Kansas City School District. We're going to talk in this segment about cultural awareness, cultural competence. You heard me make a reference to Trayvana's accent. So you're originally from where?
New Orleans.
New Orleans.
New Orleans, Louisiana.
That's right. Go
NOLA.
Saints.
Who that?
That's right. So, so being aware of culture is important, and being in a part of the country which is very different from where you came from. it's a lot of work that you have to do to truly be aware. You know, just matching skin colors or matching gender isn't always enough to truly have that awareness piece. So why is that so important as social work?
Oh, I mean, I can't even express the importance of being culturally aware in social work. We have to tap into the values and the norms that were instilled in us and really challenge those, because they may not be the same that were instilled in other individuals. And just because we don't, or we wouldn't behave in a certain way, or we don't value a certain thing, doesn't mean that that's not valued by others. A good example of that is, so just working in the child welfare arena, like I've been involved in cases where children were placed in foster care because hotlines came in that they weren't sleeping on beds, that they were sleeping on the floor, you know. And where I'm from in New Orleans, like we slept on the floor all the time. I mean, on the bare floor, no, but like patlets is what we called them. And it was like fun sleepover time. Like we would choose to sleep down there instead of sleeping in the beds. So that's maybe like a cultural thing. Culture meaning where you're from, or culture meaning the social economic class that you're in. Either way, it's something that others may not have done or may not feel is appropriate, but doesn't mean that it's unacceptable or not the norm.
Can you think of an experience where the client's culture was so different for you and you had to do a little bit of extra digging to understand it and figure out a culture that was so very different than where you come from?
I can think of a couple. The first was, well, it's been so long ago. One of them was a family that was from the Sudan, I believe, and they were living in a part of the city. They definitely believed in corporal punishment. And you know, here in the Western Hemisphere, like that is unacceptable. It's frowned upon. Like it's seen as, you know, traumatizing.
Right.
But many of us grew up getting whippings, stuff like that. This family really took it severe, like really to the next level, where there were whelps, using switches, and not necessarily because it was hard, but maybe what they were using to instill the discipline would leave the bruises. So just for something like for myself, just seeing a child with actual like whips or whelps on them or physical bruising, it was just unacceptable to me, right? Because I've never experienced that, and neither would I do that to my child. But in their culture, that's how they was raised. That's how they disciplined their children. And so that's what we saw. So accepting that and working with a family who instilled that kind of corporal punishment on their children, but still kind of insisted that they love their children and they want the best for their children, was hard to work with initially until you learn about the culture and the reason behind it, but still work with them to do something different, you know, identify a replacement behavior and what that can look like. But that was really, really huge.
It can be a challenge because I think the potential is that our own inherent biases can affect our ability to make social work judgments.
Yes.
Can affect our ability to come to a situation with some neutrality if we're already judging the client
Based on our own values
Based on
or
our own.
norms that we feel should be
absolutely.
the standard.
Absolutely.
Yeah.
Very, very difficult.
Mm-hmm.
So, all right. Well, thank you. Appreciate it very much.
You're welcome.
Hey, welcome back, class. We're continuing with Flora. She's a social worker, a master's level social worker at Rediscover. In this segment, we're going to talk about cultural awareness and diversity. So I know you and I have had a lot of conversations about cultural awareness and diversity. And it isn't always a religion or a color of skin. but it could be other things which helps drive their culture. Can you give an example or a client that pops into your mind?
Well, I had one particular client who was blind, and it was from a tragic incident. And so, just really having to understand going from one culture for him of seeing to another of now being permanently blind. And so, understanding his world and not having assumptions or even responding, because oftentimes his experience would be like people will talk loud as if he was deaf versus he couldn't see.
Right.
And so really understanding that, and it just makes me think about now several clients like either have experienced a stroke, and so understanding that difference of what they're now experiencing, a cultural difference.
So cultures can change
Yes.
for clients
Yeah.
given their environment, which we'll get to in the next segment. So that client has kind of I think a fun side twist to that case. Can you share with my class what Rediscover helped that client achieve? I think it's worth noting.
Oh, okay. So particularly this client, before he was blind, he was very active, very physically active, and he would run 5Ks. And so his desire, one of his goals was that he wanted to do a 5K. And so I got with his med prescriber, the nurse practitioner, and we signed up together with him to do a 5K. And so we ran that with him. And then the following year we did a half marathon with him. And so for him, that was like one of the greatest gains that he recognized that his sight wasn't his limitation, that he broke the barriers from there. And so and still being in a whole new culture for him, but still also recognizing there's no limitations in that new culture for him. Is that clear?
Yeah, that's clear. That's
Okay.
good. So let's see if I can catch you off guard here. So a cultural, a client who presented with a culture that you knew nothing about. Can you
Yeah.
give an example?
That's one, because I had to learn about that, or even language. So I had several clients who were Native American, who was from Africa. So and because of some of the things that they were experiencing, they were so totally culturally different from me. I really had to kind of educate myself and learn a little bit more about their culture, so that I could really better understand what they were expressing, and how to better really service them.
Yeah, absolutely. I think it lends itself to that value that we have as social workers about self-determination. We allow the clients to be the experts,
Mm-hmm.
and why shouldn't they be the expert of their culture,
Yeah.
right? Their lens, their world, how they see things, and sometimes my culture and their culture will bump heads, and we have to think about that and look at the transferences that occur. An example I was thinking of, there was a social worker that I worked with that was Caucasian, but she had married an African American male, so she had kids that were biracial, and she didn't have pictures of her kids on her desk. And a client sat in a chair who was also Caucasian and just started talking so negative about people of color. So she was in that dilemma of, well, I have children that are of color. Do I say anything? Do I not say anything? Is it triggering me? Am I the right social worker for this client? Because while we need to be aware of all cultures, it doesn't mean we have the capacity to serve all cultures. And we have to know what our boundaries are and what our end zones are.
One of the things I did want to share is that one of the things we do at this particular office, every year we have a culture fair where the staff and the clients are involved. So the staff will bring things from their culture, and we'll set up like a table, and then clients will bring in things about their culture. And so it's really neat because they get to learn a little bit about us, and we get to learn a little bit more about them. And it's not always, like you said, about race. Sometimes it's about, one guy did one on fathers, the culture of being a father. And then, of course, the one particular client, he came in and he shared his culture about, being blind. So it's a really neat fair.
That's a really great idea. So, all right. Well, thanks, Flora. Appreciate it.
You're welcome.
Welcome back, class. We're here with Evan, social worker at KU Med Center, and we're going to talk in this segment about cultural awareness and the value of cultural awareness, and really what does that mean working in such a large hospital, a teaching hospital, a hospital that has that treats a lot of immigrants, documented, undocumented. It treats a wide variety of people. So what does that mean to you when I say social workers need to be culturally aware?
It means you gotta, going back to we talked about the assessment and starting where the client is, that's a whole other piece of the puzzle is the cultural background. And you can't really, I don't believe you can really stereotype based on one's culture. Of course, they always say when you're working with different cultures, you need to learn about those cultures, but there's also subsets within every culture, which kind of makes it difficult when trying to prepare to work with a specific population. So you really got to go in, appreciate that there might be some underlying value systems that's driving their decision making, but then also just recognize that they are making the decisions that they are going to make based on whatever it is their background is. So culture here with my job varies. Obviously, we have a lot of immigrant population, both from Latin American countries, but then also Asian countries where they might not appreciate, I don't want to say appreciate, they might not be aware what our Western cultures are, or what our Western culture value is in terms of medical interventions. We are very much, we want to continue to fight until the end, whereas some other cultures might say, no, we're kind of done, we're going to come back home, or we're going to be a family. And that's how they that's how they survive, that's how they go on. So that is that's a big dichotomy that I often encounter here. And so working with cultures is just about going, based off the foundation of the cultural difference, but then also understanding that there's differences within each culture. So trying to appreciate that and trying to navigate
Absolutely.
that.
And then I had a social worker in a previous segment share with me that she sees herself as a bridge between the medical team and the client, as far as educating the medical team about the culture of that client. I know we had a really difficult case when I was at Gillis. It was a boy that had been left home alone with his younger siblings, and mom was going to work. It led to a hotline, but he was the oldest male, and in their culture, he had a responsibility to be a parental type figure, although by our cultural standards, the Western world, that's being left home alone, and that was child abuse. And so really navigating that and helping be the bridge. Do you see yourself being a bridge pretty often, trying to help your medical team understand what's going on with the culture of a client?
Yeah, for sure. Because you have a patient, the patient might not be following the medical recommendations, and all of a sudden they're just labeled medically non-compliant. And so that's the point where you have to intervene, advocate for the patient's best interest, really normalize it, saying, well, this might be happening, but this is probably what they're going off of. Is there anything that we can do in between that doesn't just label them medically non-compliant and just kind of they wash their hands away from trying to help the patient? So definitely a bridge in terms of providing information, insight, and also advocation.
Yeah, absolutely. That's a bad place to be for a client, to be labeled medically non-compliant.
Yeah.
When in fact it may just be a cultural barrier. So, all right. Thanks, Evan. Appreciate it. Yeah. Hey class, we're here with Sonia Duran at Children's Mercy. We're going to talk in this segment about cultural awareness. Now, this is such a simple question and kind of stupid, but I'm going to just say it out loud. Just because you're a Spanish speaker doesn't mean you know every person's culture who's a Spanish speaker. you're from Colombia and your client might be from Mexico or some other Central America country or South America country or even Spain. And so it helps in communication, but that doesn't give you automatic clues to their culture. So why is cultural awareness such an important responsibility for social workers?
Because then we'll learn how to work with a client. Understanding their culture is a key, is very, very important. It's not, when we are working with a client, it's not about us. Yes, we have to be self-aware, but it's about the client and how I can work with the client best.
I think you just said it perfectly. It's not about us, but we have to be self-aware, which is that key word. It's awareness, being aware of cultures. Have you been faced with a culture you weren't that familiar with?
Yes, many, especially since I'm not from here. Because a lot of the times, yes, we think people from other countries, but it's just culture. It could be somebody here from Kansas City, and then I just don't understand. I didn't grow up here, so I don't know the culture. So that's something I have to learn, or ask questions, or ask my managers, my coworkers, or just something that I have to learn over time.
Right. So there's no shame in asking a client to educate you about their culture. Because at that point, we end up making them the expert, and I think that's pretty valuable in helping to understand. So, number one recommendation for cultural awareness for a new social worker, what would you recommend that they do?
Like you mentioned, work with the client is best going into the home or working with a client and saying, hey, how does this work? I'm not sure, rather than maybe thinking or saying, oh, I know everything, I know it all. So just working with a client.
Yeah, it's not possible to know everything. So even though you're about one of the smartest social workers I know, so there you go. So, all right, thank you, Sonia.
Thank you, great.
Hey class, we're back in segment number 5 here with Melanie, a social worker at Truman Medical Center in the Futures program. If you haven't noticed on these little videos, she has the best view ever. So it's that office we all strive for. It's the office I've never had, by the way, I just want to point out. So cultural awareness, cultural diversity, why is that important to our field?
Well, I mean, our field is, historically white, female, Jane Addams, just kind of evolved from there. And without that cultural awareness piece, that's going to really undermine pretty much everything that we do. Social work, the practice of social work can be helpful, or it can actually be kind of a hindrance.
Oh yeah, we can make life worse for people.
For sure. And if we don't understand who we are, what our privilege is, what our position is, even what our the authority that we have in our jobs. My last position at the hospital, a lot of what I did working on the mother-baby unit was ensuring the safety of the mom and the baby, but specifically a newborn, because they're newborns, they can't help themselves. So if I didn't have my own sense of who I was as a person, what my own cultural background is, who I'm working with, and I could have made some disastrous choices for people just completely out of ignorance. And there's really no excuse for that. We know enough now that we need to be educated about ourselves and about how, we affect other people, how the decisions we make affect other people. And it is our professional duty to have that cultural awareness with the populations that we work in.
Right. So with your 8 years at Truman Hospital, did you have a moment where the culture that you were being presented was outside your expertise?
I mean, honestly, about every other day.
Every other day.
Because we also, that we had such a huge refugee, immigrant population. There's, people who I've never even heard of before. And so I need to educate myself on, where they come from. So sometimes I just ask.
That isn't that
the best
like
way.
the best way?
Yeah, absolutely.
Just tell me a little bit about
Yeah.
who you are
Yeah.
and what is your view of the world.
Right. And how is
Yeah.
this sitting with you right now? I'm sorry, I don't know, and I wanna know. And people actually really appreciate that when it's done genuinely. Like I need to, how does this work best? Do I, there's times, do I need to cover my head when I come in the room? Or, do I need to, how does it work in this culture with who needs to be spoken to first? A lot of those little things that I'm not gonna know, but I know that I don't know.
Right.
And I need to have that humility to find out.
Right.
And present myself as respectfully as possible.
One of the, and my students will have heard this in lecture, that the Code of Ethics made that shift in 2018, and it went from being culturally competent to cultural awareness. And I have met young social workers that are afraid to ask because they think if they ask, they'll somehow give off this notion to the client that they aren't competent.
Mm-hmm.
But in all reality, asking a client who's the expert on themselves is how we become competent. And so being aware of what we don't know is more important than being competent, because that's the foundation. You can never be competent if you're not first culturally aware.
Right.
So I personally love the shift the Code of Ethics took. I felt like it was a strengths perspective and a shift that was probably well past due. But I think you're absolutely right. It's the best thing to do. Just tell me who are you?
Right, and it's different. I think there is, I think right now there's a lot of more education about how white people have not been, well, clearly great at working with other cultures. And so there is, a piece out in the world when we're not in our professional spot of, that it's rude to ask, basically, why is someone brown, or why is someone who they are. That's not the same thing as when you're working with a patient or a client in a room where you are providing, you're the gateway to resources, or you're whatever it is that we're doing, that we need to understand that, and they want us to understand that, that I can hear this information better, if your head's covered, as a woman, if you come in with your head covered, or whatever it is, the situation. I can't really think of a good one right now.
No, but I think those are great ones, though.
Yeah.
So.
Yeah. So it's really important, and it a professional, what we do professionally is not necessarily how we behave. Well, I mean, I'm not sure if I'm making my point clear, but I do know that people feel uncomfortable asking some of these questions sometimes, just because as white people, we have kind of been inconsiderate, and people are upset about that, as they should be. But this is a little bit different, it's a professional
Right.
setting.
Right. And I know we need to wrap up here, but I just wanted to say this. So for me, when I have worked with someone who's not documented, okay, there is that hesitancy on their end because they just see a white guy. They don't know that I'm going to run off and report them to, the authorities or whatever. So for me, as I would work with a person who's not documented, I'm not even going to chart that they're not documented. It's not even going to be in my progress note. I'm going to set my notebook aside as I just say, Melanie, tell me a little bit about who you are and how did you get here. And there's this really cool tool that I will teach the students called the Culturegram, and it is in essence an echo map with culture wrapped around it, and it's kind of a cool tool. But I just think that's really important, not to be afraid to
Right.
ask those really hard questions.
Absolutely,
So-
I agree. And there's times even that I've said, I know this is a hard time right now. This is an awful time in our country, and that's not what this exchange is about.
That's right, that's right.
Um,
This is about helping you
yeah.
with resources, so.
Yeah.
All right, well, thank you, Melanie,
Yeah,
appreciate
thank
it.
you.